Neha, how are you? Welcome. Okay, I'm going to start just by asking you to tell us a little bit about the work that you do. Share for the folks who are joining us virtually.
Hi, I'm Neha Verma. I'm the co-founder and CEO of InTelehealth, and we help ministries of health to implement telemedicine. So we take brick and mortar healthcare systems and turn them into brick and click healthcare systems.
It sounds like you phrase it very simply, but I'm sure that is immensely complicated. It's like, what's the thing that keeps you up at night? I'm sure there are many, but like, if you had to pick one thing, is there anything that would come to mind that's giving you particular consternation recently?
I think the link between telemedicine or digital and health outcomes, I think someone was speaking about it a bit earlier, is how do you make sure that at the end of that digital consultation, someone's leaving with an improvement in their life and their...
Do you feel like the case for telemedicine has been proven or augmented since the pandemic? Are we now in a world where people, decision makers and patients believe in the possibility? What would you say to that?
Yeah, I definitely think since the pandemic, telemedicine has grown. I mean, prior to the pandemic, 11% of patients had access to telemedicine, and now 76%
76, 11 to 76?
regularly. Yes, and think about it for yourself, like that cough in the middle of the night. You're not going to a facility. You're going to call a doctor and speak with them. So the pandemic has really shifted adoption from patients and from providers and from ministries of health, which is who we primarily work with.
That's I guess not surprising in some sense, but it's really powerful to hear that that is the trend line. So you really see that this is going to continue not only to increase in number of users, but the depth and how many services people access. I personally love it. Even when I travel, I still have access to some of my providers in the United States. One Medical is a group I really like, and I can talk to nurses and people remotely. So that's quite powerful. All right, so I have a question for you. If you had give us a case for optimism for digital health as we turn the corner to 2025, what comes to mind? Brick and click.
Brick and click.
We already got our catchphrase going. I love it. Go a little bit deeper. Tell me why you're hopeful. What does get you excited about this sector and this time?
I think what's really important about Brick and Click is women's health and equity of women's health. Digital and this click can create a safe and accessible space for a woman. When she is confronted with a geographic distance she has to travel, more often than not, she's going to miss care or delay care. In fact, 6 in 10 women either miss or delay.
6 in 10?
Yes. And when you put in a telemedicine system, you can now transform that. And we've seen that in our projects to get to 9 in 10 women getting to care within 8 hours. So that's really the transformative potential of the click. And I don't think we talk enough about the gender aspect of how we make our systems more gender sensitive and accessing the most vulnerable.
Well, I know people talked about the phones as being a sort of like, what's the right word, kind of headwind for gender equity, but really kind of taking that a next step. And it's not just about receiving text messages alone, but like full point of service, point of care through telemedicine for marginalized populations, especially women. It's such a powerful work you're doing. Really exciting to hear that. So listen, Neha, we wish you a wonderful conference. We thank you for stopping by the Pop-Up Studio. We want people to check out your work. Show them one more time.
InTelehealth.
Okay, fantastic. All right, thank you so much. Enjoy your lunch. Take care.